So I don't know about many of you, but I pay for private healthcare insurance through my company, and it's a group plan. And I have experienced year over year fairly substantial premium increases on my insurance. Seems like it's been, I don't know, 20% or more per year. I mean, it's literally sticker shock. Every December, I get a letter in the mail saying, here's your new insurance premium for the coming year. And it's insane. It literally never stops going up. And I have a pretty good policy, but the deductibles now are so high that you pay out of pocket for almost everything anyway. If you don't go to the doctor a lot, you're paying out of pocket. Yes, they adjusted a bit, but you're paying for deductibles. You're paying for co-pays when you go in to see anybody outside of your normal general like gatekeeper doctor. And on top of that, then you get hit with bills, weeks and months later for any kind of services you have to have. Plus, you pay. I pay the monthly premium. So this is disturbing. It should be to many people. It's out of the Zero Hedge a couple days ago. I meant to share it with you, but I did save it, and I just haven't got around to it till today's video. Insurers request huge Affordable Care Act rate hikes, many over 20%. It says medical care costs are surging already. A big leap is coming. The Wall Street Journal reports that it calls it Obamacare, Affordable Care Act, insurers seek double-digit premium hikes next year. It says if you buy your own health insurance, you're probably going to pay more next year, a lot more. Insurers are seeking hefty 2026 rate increases for Affordable Care Act marketplace plans, the coverage known as Obamacare. Blue Cross and Blue Shield of Illinois want a 27% hike, while its sister Blue Cross plan in Texas is asking for 21% hike. The largest ACA plans in Washington State, Georgia, and Rhode Island are all looking for premiums to surge more than 20%. The companies say the big increases are needed because of higher healthcare costs and changing federal policy, including cuts to subsidies that help consumers pay for plans. Well, I don't know what those subsidies are, but I don't think I've ever received any of those subsidies. Leave your comments and your thoughts. Have you, if you're paying for private health care? The higher premiums would come after years of enrollment growth and mostly single-digit rate increases in the Affordable Care Act market. Again, I believe mine have been double digits, where individuals and families buy insurance for themselves. About 24 million people have Affordable Care Act or ACA plans. At the request of the Wall Street Journal, the health research nonprofit KFF analyzed the rate requests for the largest ACA plans by enrollment in 17 states where the insurers' filings have already become public, as well as the District of Columbia. They showed that some of the biggest national ACA players, including Centene and Elevance Health, are seeking double-digit increases in several states. Blue Cross and Blue Shield plans of Texas and Illinois are both owned by Healthcare Service, a giant nonprofit. Most Obamacare enrollees' monthly insurance bills will go up substantially next year because of reductions in federal subsidies that help pay for the coverage. Enhanced payments, it says, passed by Congress in 2021 will lapse at the end of December. The drop-off in subsidies is both helping to drive higher premiums and making it harder for many consumers to pay those premiums. Some people are going to be hit with this double whammy of bigger monthly insurance bills and losing the subsidy that blunts their cost, said Cynthia Cox, a vice president at KFF. In rate filings, some insurers said that tariffs could also add to the cost of drugs and medical supplies. So this may be some of the culprit. Listen to this. After a rough 2024, Insurers are warning that 2025 won't be better. The trouble started when industry giant United Healthcare Group, UNH, ousted its chief executive, probably CEO, and withdrew its outlook in May, blaming higher costs and Medicare Advantage. Then earlier this month, Centene CNC pulled its guidance, citing a sicker than expected population on plans under the ACA. And this week, Molina Healthcare cut its profit forecast, citing cost pressure across all its government plans, including Medicaid. It says the trouble has sent shares of insurance companies plunging. This also comes as the recently passed tax and spending package is set to cut more than $1 trillion in healthcare spending over a decade. Some might see an opportunity, it says, to buy the dip in terms of the shares, but value can only be measured if you can trust company numbers, and increasingly the investors can't. What's happening if the shares aren't being purchased? The companies start to struggle. The core problem is that the assumptions insurers rely on to price plans, how many people will enroll, how sick they will be, and how much care they will use are no longer holding up. Medical usage has surged and become more volatile in the post-pandemic landscape. Changes to how insurers and providers are allowed to bill and code care have eroded margins for payers, and the mix of healthy and sick enrollees in government-sponsored plans is shifting as millions fall off insurance rolls. The reason it says each government program is struggling might differ, but the bigger picture is the same. Surging medical costs are outpacing what the government is willing to pay. Over the past 4 years, most large managed care companies have lost investors' money, per above comment, right? Investors are losing confidence in the stock. United Healthcare, Centene, CVS, Elevance, and Humana HUM are all down over that stretch. Of the major competitors, it says, only Cigna CI has delivered a positive return. The reason why, according to this article, it steered clear of the government-heavy business lines now under pressure. Cigna left Medicare Advantage and has focused instead on commercial plans sold to employees. And this is very interesting. The CPI numbers that we get, right, every month, says only partially picks this up, because it says CPI only covers prices paid directly by consumers. Again, we talk about whether the official numbers on a whole host of metrics all the time are actually accurate and reflect the true expense and cost that people are having to bear. And again, in this case, the CPI metric doesn't. To the extent Medicare, Medicaid, and corporate plans pick up the cost of these premium hikes, the CPI will not pick up those jumps. For example, in the United States, around 65.4% of the population has private health insurance, which includes both employer-sponsored plans and direct purchase plans. A significant portion of these individuals pay a portion of their premiums, with employers typically covering a large percentage, right? For instance, employers pay on average between 80 to 85% of individual coverage costs and 67 to 75% of family coverage costs, according to WellHub. Other sources of coverage include Medicaid, that's 18.9%, Medicare 18.9%, TRICARE 2.6%, and VA and CHAMP PVA, if I'm saying that right, 1%. The CPI only reflects percentages directly paid by consumers. So it says your costs may jump, right, starting in 2026, 24%, but the CPI will only reflect just a very tiny share of that. Medical care services, 6.736% of total CPI, and medical care commodities, 1.516% of total CPI. So it says, kind of tongue-in-cheek, tell anyone who pays their own insurance that medical care services is only up 6.7%, is only 6.7% of their budget, and they will think you are on Mars, right? But that's what the BLS, Bureau of Labor Statistics, right, says after factoring in the percentage paid by Medicare, Medicaid, and employer coverage. So if you are in an Affordable Care Act plan, if you are paying for your health insurance privately, and certainly if you do not have any contribution from an employer, this is going to be more sticker shock, unfortunately, for you in the coming year. So, what is the solution? Obviously one solution is to, I guess, move to a state where the healthcare costs aren't quite as much, or try to change plans, but it's complicated. It's not that easy. I've tried to shop, our plan many times, and I go in circles with it. So I don't want to go too long today. That is unfortunate news at a time when people in this country can least afford an increase in expenditure. A family that's barely making it, and if they all of a sudden have to a line item expense like healthcare, have a 20% jump in that expense, that's the difference between being able to make your bills every month and not make your bills every month, okay? And I'll pretty much guarantee you that your salary is not going up by a requisite or a corresponding percentage year over year. So there you have it. Get ready for more healthcare shock, okay? Less benefits and more expensive. So I'll leave it there today. I appreciate you guys. Again, if you enjoy the content, leave me a like, and please hit the subscribe button if you're not subscribed. As always, I welcome your thoughts and comments. With that being said, I will talk to you soon. All right, bye.